Barbro Fride, thank you so much for joining us at the Nuffield Trust Summit. I wanted to ask you, what do you think that larger hospitals can do better?
What we can do better, we can collect large enough caseloads to become proficient in what we do. We can develop new methods and improve on them, and then move out to the smaller hospitals with the innovative ideas that we've had.
And you talked about moving out to the small hospitals. How in your hospital do you work with the smaller hospitals locally?
We work in the regional setting, so we have a regional board, and we have decided now to concentrate care to certain hospitals in the area. So different hospitals do different things, but in large enough caseloads to become really good at what they do. And then we collaborate and form a network, which also include academia.
Is it the size of the hospital or the amount of work that the physician or the team are doing that really matters in your experience?
It's certainly what the physician and the team are doing that's the most important factor. The size of the hospital isn't necessarily an issue, but even if you have large groups of patients to treat, that's not enough. You have to improve your quality by using quality registers, by follow up your outcomes continuously and very systematically, and that's how you improve your results.
Could you say a little bit about how you're really using value-based healthcare in your hospital to drive improvement?
What we do is we let the professional teams, with multi-professional teams, sit down and evaluate their own results together with the patients. And from these discussions, they decide on what to improve, because they're never happy with what they have. They always want to improve. They have a passion for their patients. And the patient really tell the professionals that this matters for me or for us. So we get the patient's view in all of these discussions. And that's how we work. And it's quite systematic and quite disciplinary work, but you let the professions decide on course of action. And I, as a manager, cannot tell them what to do. They have to decide that themselves.
And have you found that the professionals are really engaged with that way of working? Is it delivering results?
Yes. It's better deliverance than anything I've tried before in healthcare. I mean, I have 16,000 staff. I can't control all of these 16,000 people. I have to make them want to do what I would like them to do by themselves, and this works. So we give them autonomy in exchange for a systematic way of working.
Yeah. And how important is that patient involvement in that process?
It is very important, because healthcare has been notoriously bad at looking at our results from the patient's point of view. And the patient, a lot of time, asks for totally different things than we have looked at ourselves. For example, with our group working with bipolar disease, the patient representative said that the most important medical outcome for us is how many of us have full employment at age 30. Because if we've done our jobs well as the medical profession, they have a greater chance of having a full-time employment, and their life will be better. But it also opens up for collaboration with social workers, with society at whole. And it makes our medical background so much more a part of what's going around the patient and not the only thing.
Yeah. So if there's one lesson from all of that experience that England might take from Sweden, is there anything you'd point to?
I think our national quality registers have been so important in this work, and I think that would probably be helpful in England too. And the thing is that we also have total transparency on the results, improve quality of care.
Thank you so much.